According to the World Health Organization, more than 116 million people across the African region were estimated to be living with mental health conditions before the COVID-19 pandemic. Suicide rates remain particularly concerning among adolescents as young as 13 years of age. Well, let's discuss the picture today with Linda Mthenjane, clinical psychologist, and she is with the Space Between Us. Linda, good afternoon. Thank you very much for your time. Yesterday, the 10th of October, was marked as World Mental Health Day. Why is it important for us to acknowledge this day and mark it?
Good afternoon, Dan, and thank you very much for having me this afternoon. The reason it's important is because mental health is as important as physical health, and marking the day means that we're able to acknowledge, raise awareness for people who are living with mental illness, but more importantly, the importance of looking after our own mental health, given that mental health really determines the kind of life that we have.
Yeah,
our happiness, relationships, everything, Dan.
Yeah, and this month of October, of course, in South Africa is also Mental Health Awareness Month. Now, COVID-19, and of course with the lockdowns that it brought, it raised the awareness around mental health, mental well-being, and becoming an easy topic in boardrooms and in meetings of excos. But people still fear talking, Linda, about mental health. I just wonder why. I mean, is it around the stigma issues?
No, definitely it is. And you're right. So we're finding that whereas before, mental health certainly wasn't a topic around boardroom tables, it is now. And it is largely because of the impact that it's having in the way that people are working, hybrid work environments, etc. But people themselves are still a little bit wary because there hasn't been enough education. The stigma really comes from people fearing being isolated, fearing that they're the only. And what becomes important is the ability for us to really raise the level of skills and development around mental health so that people understand that actually this mental health is something that we all have. It's the illness that we need to be aware of.
So what's the difference between mental health and mental illness then?
Yeah, no, that's actually a very good question, because often when you talk about mental illness, most people, in fact, when you talk about mental health, most people think illness. But actually, it's a continuum. I'd like us to think about it that we're all, at some point, we're thriving, our relationships are working, but then something will happen, whether it is a stressor, whether we have a difficult time, we lose our job, and we may perhaps then have what we call common reversible stressors, like we can't sleep, we can't eat properly. And if we don't take care of that, we may actually even become mentally injured. And then the only time we talk about illness is really right at the end. And a lot of the illnesses have some sort of genetic element to them, but the illnesses that people fear are really just one part of the stress, one part of a really long continuum of mental health. We all swing up and down this continuum depending what is happening to us. And I think what becomes very important is really just to have the skills to be able to manage our mental health, very much like you have skills to manage your physical health. This is what becomes important.
Thank you very much, Linda Mthenjane, a clinical psychologist and advocate for mental health from the Space Between Us. Yesterday, of course, having been World Mental Health Day, and this month here in the country is a month of mental health awareness.